Hello. Welcome to 2-Minute Emergency. I am your host, Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I come to you today with another episode of 2-Minute Emergency to help keep you healthy, safe, and out of the emergency department. So today's topic is National Sickle Cell Month. And that is the entire month of September. And the purpose of this is to make people aware of the disease itself, the research that's still necessary to be done as far as helping people who suffer from this disease to live their best lives. So I'm so glad that you're able to join me today to learn a little bit more about sickle cell anemia. So let's start off by saying, what is sickle cell disease? So sickle cell disease is when you have, the best way to describe it is we have hemoglobin in our red blood cells. This is a disease of the red blood cells itself. And that hemoglobin carries oxygen throughout the body as it travels through the different blood vessels. Well, because sickle cell disease is an abnormal hemoglobin, it has impaired ability to carry oxygen. And what happens is it changes the red blood cells from their normal disc-like shape, which makes blood travel easily through the blood vessels, to a sickle shape and more like a crescent shape. And that causes the blood to stick together, the red blood cells to stick together, and to cause blockages. Now, these blockages can be incredibly painful because you can imagine you're depriving whatever tissue that is of the oxygen that it needs. And that is the basis, just to kind of sum it up, for sickle cell disease. Now, people think about sickle cell disease, they think of the African American community. And sickle cell disease is indeed more predominant in anyone of African descent. However, it's not limited to African Americans. It's also found in the Latino community, people of Mediterranean descent, people of Southeast Asia. All of these individuals have sickle cell disease within their community. Now, within the United States, we don't know exactly how many people have the disease. There are estimates of around 100,000 people. But what we do know is that it's roughly 1 in every 365 Americans, African Americans, that is, have sickle cell disease. So that's a pretty large amount. As far as in the Hispanic community here in the US, it's roughly 1 every 16,000 people of Hispanic descent. So that means that 1 out of every 13 African Americans that are born in the United States have sickle cell trait. Now, why do I mention trait? So trait is when you have one of the mutations. So both parents have to have at least the trait or the disease for their child to have the disease. So 2 people with trait have a child, there's a 50% chance that that child will have the disease as well. So pretty high odds, obviously. Now, the trait is a little bit different from the disease because generally people who have the trait do not have painful crises. I said generally. The reason I say generally is because under certain circumstances, you can have crises, usually not crises, but you can have pain, you can have other symptoms. Now, how do I know so much about sickle cell? Well, there's 2 reasons. One is to tell you a little bit more about me. I have sickle cell trait. That's number 1. Number 2 is, if you know a little bit about me, I love to travel. And I'm a pretty adventurous person in general. And 2 of the things that I have done would be predisposing me to have some of the effects of sickle cell. Because people with the trait can be affected in areas of low oxygen. And the example of that is I was hiking in the mountains, the Andes Mountains, and it was very difficult for me to walk very far before becoming incredibly short of breath. And the other thing is, although I haven't done it in a while, I used to do scuba diving. And I never had a problem underwater, but probably because I wasn't going deep enough. I probably stopped at about 35 feet. But anything below that, more likely to have difficulty breathing, possibly even have those crises that I mentioned. But that's the trait. Generally, most people are not affected at all. But back to the disease, a lot different. So the good thing that we found is, or that we now do, every child that's born, every child is screened for sickle cell disease. So that's at birth. So it's not a question anymore. People know right away. Now, when do these symptoms start to occur? Well, when we're born, we have fetal hemoglobin. Everyone has fetal hemoglobin, and then it changes to the sickle cell if that's the case for you. So roughly at about 4 to 5 months old, you start to have your first crises. They're generally manifested with the symptoms of having swollen hands and swollen feet. Then they start to have the painful crises, things like that forward. Now, what do we do for people who have sickle cell disease and have these issues? There is no one standard treatment. There's no one size fits all because there's such a variation from mild to severe disease. So some people may be able to be treated just with normal anti-inflammatories, acetaminophen, ibuprofen, things like that, to those people that require narcotics, to require hospital admissions to treat them. So there is no, I'm not going to say there is no cure. The cure for sickle cell is bone marrow transplant or stem marrow transplants. So not done very often, but there are cases where they are definitely done, and that is essentially a cure. So when someone has sickle cell disease, how do they prevent these crises? Well, as I said, taking the specific regimen that your doctor has prescribed, whether it's your hematologist or your primary care physician, making sure you keep up with your medications. Another thing that can precipitate crises is dehydration. So I know you guys have heard me talk so much about making sure you drink your water. Well, that's one of the reasons too. Water is so important to the body, and helping to stay hydrated helps to prevent some of those crises. Because that's one of the first things we do for patients that come into the emergency department is we make sure that we give them the IV fluids that they need. And last but not least, making sure that you are avoiding those stressful situations because they can also happen in athletic competitions, things like that, where you're exerting yourself to high degrees, you become more fatigued. Now, there is another side of sickle cell anemia, and that's the anemia side. So the reason that people become anemic is because those sickle cells are more fragile. And so they don't last as long. As I said, they don't carry the oxygen, but they also break down. And so symptoms of that can be fatigue, lightheadedness, dizziness, shortness of breath. People also, because of that breakdown, their eyes often turn a pale yellow. That's the white around their eyes. And that's not related to liver disease. That's just the breakdown of that hemoglobin. So these are just some of the things that we see in people that do have sickle cell disease. So other things that can happen because it affects every part of the body, they can have vision loss. They may have leg ulcers. They may have what's called acute chest syndrome. They may have strokes. They may have blood clots, DVTs in the legs. They may have pulmonary embolisms or blood clots in the lungs. All of these are potential side effects of sickle cell anemia. So I hope today you've learned a little bit more about this disease that affects so many people worldwide, and you'll be aware and know that there's so much research that still needs to be done. One of the things I forgot to mention. So the second reason why sickle cell is near and dear to me is sickle cell is one of those things that helped propel me into medicine in the first place. Back when I was in high school, I did sickle cell research at the University of Pennsylvania during the summer. And that started I was always interested in sciences, but it propelled me in my love of sciences and doing more as far as research, learning more about the body and how it works. And prior to that, I didn't even know I had the trait. So things were a little bit different then. So at that time, everyone who worked in the lab donated blood. to be used for experiments. And so I donated some of my blood, and they called me over. They were like, Leslie, your blood is sickling. I was like, how could that be? That's impossible. Well, I found out. That's how I found out I had the trait. So that was before the testing was done on all newborns, needless to say. But I hope this was a benefit to you. I hope you enjoyed this conversation, and I hope that you share this with other people. So you can find all of my 2-minute emergencies on my YouTube channel, Dr. Leslie, or you can find me on all social media at Dr. Leslie Sharp. So until next time, stay healthy, safe, and out of the emergency department. Take care.